everyone. My name is Christopher Barker. I'm a clinical psychologist licensed in New Jersey. September is National Suicide Prevention Month, and I thought I would put a trigger warning out there for anyone who may be concerned about that topic. But I think it's something that we should all be concerned about. The level of stress and depression and anxiety that I'm seeing on a fairly frequent basis is certainly cause for concern, but suicide is a different animal. And I thought I would give you some warning signs, how I would do an assessment, and you can do something similar with anyone who mentions suicide or seems to be contemplating it. The traditional things that they have always told us are feelings of hopelessness, helplessness, depression. Those are not always observable. Those are not always something that somebody will come out and tell you a lot about. But you can look and see if someone is talking about dying, if they are saying that they feel like there's no point to life. There's a sudden mood change, especially if depression is suddenly lightening for no particular reason. It could be that they've made a decision, and the decision is to get out of this depression in the only way they can think of. Giving away possessions or saying goodbye to people is a bad sign, because that is pretty much an indicator that the person is not planning on coming back. Closing bank accounts, that sort of thing. Tidying up, that can take a while, and if you see someone that devoted to that sort of plan, then a plan is never a good thing. So what do we look for? If someone comes to me and I'm concerned about suicide, first of all, I ask them directly, are you thinking about suicide? There's an old myth that you can give someone the idea and they'll be like, oh yeah, suicide, I could do that. You can't. If people do not want to end their lives on a routine basis, and if they do, if you ask, you'll either get, no, things aren't that bad, or you'll get, yeah, I'm really glad you asked about that because I have been thinking about it. Asking directly is usually the best way. Things like asking about, are you thinking of hurting yourself? That's not as likely to get you a direct answer. You also want to look at, are there any of the aforementioned issues about giving away things? Are there any plans? Do they have any future orientation? If they have plans to take a class next week, if they are enmeshed in doing things, if they have family, if they have connections, those things are less dangerous, because if a person is connected, they're less likely to want to end their lives. We also look at substance use, because anyone who is drinking on a regular basis or using recreational drugs, they're less likely to be inhibited, and so they are more likely to give in to their impulses. We want to look at if there's a history of suicidal behavior, or if there's a history of family suicidal behavior, because it is something that can be learned. So if you have a history of trying to kill yourself, then it is more likely that you will try it again. Because if you can go there once, you can go back. Lethality, how would they do it if they're talking about it? Okay, so if you're thinking of suicide, how would you kill yourself? I don't know. Maybe I'd take some pills or something, is a less lethal response than I have a gun under my bed. Those things are much more dangerous. And again, when you're assessing lethality, you have to look at all the important factors. Do you have a method? Have you done this before? Has anybody in your family done this before? Have any close acquaintances done this before? And if the answer to any of those is yes, be concerned, because it's something that we can't take mildly at all. We can't just assume that people are going to be okay. Frequently, we do not know. And if people have firmly decided, they often will give no indication whatsoever. You can ask them point blank, are you thinking of killing yourself? And they will say no. And they will give you all kinds of answers about things that they have planned, because they don't want to be stopped. They've made their decision. So don't feel bad if you miss something. But if you've done a very thorough assessment, if you have asked your family or friend, are you thinking about it? How are you thinking about it? What are you thinking of doing? Are you drinking? Are you using any drugs? Those things will be indications that the person must be taken seriously. And it's okay to call 911 and have them taken to a hospital. It's not likely that they'll get there by themselves if all those factors are in play. How do we prevent suicide? Connect, build strong social supports and networks. Be there for your friends. Make sure that they have friends. Make sure that there's someone who's going to be around and available that they can talk to. Make a plan for safety. And we do this routinely with people. We will write out, if you're thinking about doing something deadly, who are 3 people you can call. Let's write their numbers down. I want you to take this and put it on the refrigerator or somewhere that you can see it every day so that you don't have to stop and think about it. We want to identify some things that the person can want to live for. We want to educate. We want to promote mental health literacy and reduce stigma. We want to be able to talk about these things, and the American Association of Suicide Prevention is a good cause. They're doing marches and walks this month, and reach out to them, make a donation, see if there's something that you can do, see if there's an activity going on in your neighborhood. The more that we spread the word about this, the more likely people are to pay attention and possibly change their lives. You want to restrict access to lethal means. So if a person has guns, lock them up. Make sure that they are locked away. Take them away from them and say, until I'm convinced that you're safe, no access to this. Medications. Give me your medicine, hold until you're feeling better. Follow up. Refer people to therapy. Make sure that they go. We have a bit of a waiting list, but not much. So if you want to call Discovery Psychotherapy Center, you can. Our number is going to probably appear at the bottom of the screen, 973-796-3760. We do have therapists who are available. We do take insurance. If it's not us, then find someone and go. Be seen. Find someone to talk to. Because odds are you've thought yourself into a corner and you haven't seen a way out. But there are ways out. There are always ways out. Nothing ever has to be that desperate. Listen without judgment when someone is talking about their feelings. Don't judge them for what they're feeling. Don't call them a coward. Don't assume that they will respond in some way to jokes or you can cheer them up or jolly them out of it. You really can't. When someone is feeling that bad, they only see one way out. They may not have thought of all the alternatives. So brainstorming alternatives. What would make you happy now? What would make you feel like tomorrow would be worth going on? It could be anything. Throw some things out there. Do you have pets? Do you have relatives? Do you have friends that you could call? When you make that plan for safety, you also want to put on there the suicide prevention hotline, 988. And again, this will probably appear at the bottom of the screen. Do not hesitate to use it. There are counselors who are on duty. There are rumors that it's going to be discontinued, and those are not true. It's still in operation. If you have issues that make you feel separate from other people, transgender, serious illness, drug use, those things can get in the way of feeling like you can connect to other people. Everything is worth talking about. And if you can't talk to a friend, call that number. And put that number on your suicide plan, your prevention, your contract for safety. Make sure that there is the number for the nearest hospital. Write 911 on there, for Pete's sake. I mean, sometimes people are in a dire situation and they can't even remember the 911. Make a plan for safety. The most important thing is talk about resilience through purpose, connection, coping skills. Be a friend to people who need it. And if you cannot be there for them, then make sure that they have someone that they can talk to. This is a serious issue. I've been a member of the American Association of Suicidology for 30 years. And I've presented numerous times and at panels, and the issues remain the same. The way people approach life, and when they feel like they're running out of room, when they feel like they're painted into a corner. If you're feeling this way, call someone. If you like these presentations, like, subscribe, leave comments. I'm always open to comments. I almost always answer. It may take me a couple of days, but I will. And please, let's be careful out there.